Hey everyone, and welcome. So, in the world of medicine, we're always hearing about the incredible promise of artificial intelligence, right? How it's going to completely revolutionize diagnostics, personalize treatments, and just make patient care so much better. But here's the thing, there's a huge gap between an AI model that works in a research lab and one that actually works in a real, chaotic hospital. Today, we're digging into a really fascinating review from the Journal of Medical Internet Research that gets right into this exact problem. It explores why so much of that AI promise gets stuck in the lab and introduces a powerful concept for finally bridging that gap. Okay, let's get into it.
So we're going to start with what I like to think of as the AI healthcare paradox. You see, there's this absolute explosion of research out there. Thousands and thousands of papers are being published on new machine learning models for medicine. The potential feels huge. But the reality on the ground, well, that's where things get a little weird.
And this number really says it all. The paper points to this pretty shocking statistic. Despite all of that research and all that development, fewer than 10% of these brilliant models are ever actually used in a clinical setting. Think about that for a second. That means more than 90% of this work, all this potential to help patients, it just never leaves the lab. It's a massive, massive gap between innovation and implementation.
So that leads us right to the big question we're tackling today. What's going on here? If these models are so great, what's stopping them from being used to help doctors and patients every single day? Well, the answer, as this research suggests, isn't really about building better, smarter algorithms. It's about building a better system around them. And that system has a name: MLOps. This is the key idea, really the missing piece of the puzzle that the paper brings to light. It's a term that's borrowed from the tech world, and it's all about turning a machine learning model from, a fragile experiment into a robust, reliable tool that you can actually count on.
So, what exactly is MLOps? Well, think of it as the operational backbone for AI. It's not the model itself, but the entire process for managing its lifecycle. MLOps creates a standardized workflow to take a model from just an idea all the way to deployment, and, this is the crucial part, keep it running effectively and safely over time. This is just standard practice at places like Google and Microsoft, but for healthcare, it's pretty new ground.
Now, the paper outlines a pretty detailed 8-step workflow, but we can really boil it down to 3 main phases. First up, you've got data and preparation. That's all about pulling, cleaning, and getting the data ready. Next is model development, which is the part we always hear about, training the algorithm, seeing how well it performs. But it's this final phase, operations and monitoring, that's where the real MLOps magic happens. This is about actually deploying the model, keeping a constant eye on its performance, and automatically updating it as new data flows in.
But here's the thing, not all MLOps is created equal. The researchers came up with a really simple and useful framework with 3 levels of maturity to gauge just how advanced an organization's AI operations really are. Let's break those down.
At the very bottom, you have low maturity. This is pretty much a set-it-and-forget-it approach. A model gets built, it's deployed, and then it's locked or frozen in time. It doesn't learn from new data, and nobody's really tracking its performance actively. The big risk here is that medicine is always changing, new treatments, different patient populations, and a static model can get outdated, inaccurate, and even dangerous fast.
Okay, let's move up to the next level, partial maturity. This is a big step up. Here, organizations are actively monitoring how the model is doing in the clinic. They can actually see if its accuracy starts to slip. But, and it's a big but, the process to update it is still completely manual. When performance drops, you have to call in an engineering team to manually retrain and redeploy the whole thing. So they're keeping an eye on it, but the system can't fix itself.
And finally, we get to the gold standard, full maturity. This is a truly adaptive, living system. It doesn't just have continuous monitoring, it has continual learning. The system is constantly watching its own performance, and the moment it detects a drop below a certain point, boom, it automatically kicks off a whole pipeline to retrain, validate, and redeploy an updated version of itself on new data. It's an AI system that literally evolves along with the hospital environment.
So where does healthcare actually stand today? Well, the paper looked at 19 real-world implementations, and the results were pretty surprising. Out of the teams that actually got their models into the clinic, a huge majority, 13 out of 19, achieved that full maturity level. This kind of suggests that while just getting started is the hardest part, the teams that do break through tend to go all the way, building these really sophisticated, adaptive systems right from the get-go.
But as you can probably guess, achieving that full maturity is not easy. And that's because healthcare isn't like any other industry. It comes with its own unique set of really high-stakes challenges that make implementing MLOps especially tough.
And here's the thing, these roadblocks aren't just technical. You've got massive data privacy concerns governed by laws like HIPAA and GDPR. You have complex regulatory bodies that you have to keep happy. You need buy-in from the clinicians who have to trust the model with their patients, and from the IT departments that have to support it. And maybe most critically, you have to constantly fight against model bias to make sure the AI is providing fair and equitable care. These are huge operational and ethical mountains to climb.
And this brings us to a really fascinating tension that the paper points out. The regulatory bodies, the ones whose job is to ensure patient safety, they often actually prefer those locked, low-maturity models. And why is that? Because their performance is stable and predictable. An adaptive, self-updating model introduces a level of uncertainty that makes regulators, understandably, a bit nervous. So the very thing you need for a robust AI system, adaptability, can be at odds with the current regulatory mood.
So, what's the path forward here? How do we navigate all these challenges and finally bridge that gap between the research lab and the patient's bedside? The paper argues it requires a fundamental shift in how we think about the problem.
This, right here, is the key takeaway. For way too long, the focus has been on perfecting the algorithm, making it a little bit smarter, a little more accurate. But the real challenge isn't the model, it's the ecosystem. Success means building the data infrastructure, the stakeholder trust, and the operational maturity. The whole MLOps framework that allows these powerful algorithms to not just be deployed, but to thrive, adapt, and provide real, lasting value in a clinical setting.
And that leaves us with one last provocative question for every leader out there in healthcare and health tech. As you invest in AI, are you just funding the creation of more models that might end up sitting on a shelf? Or are you investing in the operational maturity required to turn those models into real, working, and evolving solutions that will actually help patients? The answer to that question is what's going to determine the future of AI in medicine. Thanks for joining me.